Uh, Today, as we go on with the next part of our session, I would like to welcome Mr. Ramakrishna Paul. Just brief introduction about Mr. Ramakrishna. Mr. Ram is a civil engineer by his qualification with a postgraduate degree in water management and governance. He began his career in designing decentralized wastewater treatment systems and was instrumental in coming up with the first biological fecal sludge treatment plant in India in Devanahalli. Following this, Ram was engaged in various capacities, providing advisory services to local, state, and central governments and donor organizations for improving sanitation service levels. Ram has supported the governments of Bangladesh in developing city sanitation plan for more than 40 plus Poroshobhas or municipalities, impacting the lives of more than 2 million residents. Further, he has supported the government of Karnataka, India in evaluating the impact of Swachh Bharat Mission, Grameen first phase, and provided recommendations for effective implementation of the second phase. Ram also supported the National Water Utility of Uganda in providing water supply services to the hard-to-reach population in small towns of Uganda. Currently, at Athena Infonomics, Ram works in the intersection of data governance and safe sanitation services. He provides technical advisory support to regulators and implementers in strengthening local data systems and utilizing data for delivering equitable, safe, and sustainable sanitation services. Over to you, Ram, to take us through the MLE.
Thank you, Dr. Rajeshi. And thank you, Jyotsna and Professor Chari, for that last session. I think a lot of interesting suggestions and recommendations with respect to the kind of indicators that we should look at came up, which also relates to some of the indicators that we will discuss in today's, in this particular session. I'll just share my screen. Let me know if my screen is visible.
Yeah, it is.
Okay, great. Good evening, everyone. So I'll be talking about CWIS indicators and some of the tools that are currently available for monitoring and evaluation, and also some of the tools that are available for planning. But then before getting into that, for those of you who do not know about Athena Infonomics, I'll give you a very brief introduction about the organization and our experience and what we have been working in. So we are a data-driven global consultancy, and with a very strong focus on social science research and data analytics and data governance. We are headquartered in India, but then with offices across Kenya, across US and UK. We have program hubs in Sub-Saharan Africa and South Asian countries as well. Some of the sectors that we work in, water and sanitation being one of the most prominent ones, but then we are also very much effectively supporting governments in delivering services on housing, urban development, healthcare, agriculture, education. Particularly for today's session, I'll focus on the water and sanitation expertise that we bring in. We have worked, and the team members, we are a team of around 70 plus professionals spread across different geographies. And we work in various different aspects, including integrated water resources management, solid waste management, data systems, monitoring and evaluation, and citywide inclusive sanitation. Which is very much relevant for today's session. But then before we get into the monitoring aspects of CWIS, I just wanted to showcase some of the work that we have been doing in CWIS and some of the tools that are available on public domain. I'm given, and and given that there are so many different tools that are currently existing in the public domain, and oftentimes as users, when we are using the tool or we are supporting utilities and governments with respect to any kind of using a tool for any kind of implementation or any kind of planning, it's very important for us to understand these tools. So I'm given to understand that the FSM toolbox, and there has been already a session on FSM toolbox by colleagues, by our partnering colleagues at FSM Alliance. We developed the FSM toolbox, and right now it is being anchored by the FSM Alliance, which helps in sanitation situation assessment. So there is a shade flow diagram, which basically helps you to understand what is the current situation in terms of the baseline scenario, and then also helps you to go on to plan for citywide FSM infrastructure planning. And then once you have assessed the situation and understood what the infrastructure planning could look like, then there is the citywide inclusive sanitation framework, the monitoring framework, which basically the measurement framework, which basically helps you understand how the cities are performing with respect to different components of the CWIS, be it equity, be it safety, be it sustainability, all looking at accountability, responsibility, and resource planning and management. So to understand the city's health in terms of these 6 components. And we will talk more about the citywide inclusive sanitation framework, the measurement framework in the upcoming slides. What we have also developed is when we saw that, given that over the past few sessions, I'm pretty sure all the participants here would also be discussing about how going beyond or talking beyond infrastructure or setting up infrastructure to achieve outcomes or to achieve safe outcomes. It is also about service delivery. It is about looking at how the poor is getting services, getting access to services, or how the lower income settlements, or how the hard to reach populations, or how the vulnerable communities and sanitation workers dignity is maintained. So service delivery is beyond just infrastructure, and there is a tool which is a service assessment and planning tool, which basically helps you in developing service plans in terms of interventions, and also in terms of understanding which investment is correct for me for the particular city. So that's, and I'll briefly touch upon this in today's session as well. In addition to that, we also have developed a risk assessment tool. And I'll share the links. I mean, like the presentation is I'll share it. I hope Josna and team can share it with the participants. So all the website links are mentioned over here. They are all open access websites, and you can go into there. And I'll also share my ID with you, email ID with you. So please do get in touch in case you have, or do write to ASCII team, and we all can get in touch with you in case there is any kind of support required on that front. So coming back to the risk assessment tool, so that's a open access tool. Basically, it's a tool which depends on publicly accessible data to help you develop geospatial maps with risk profiles in terms of economic profile, risk in terms of climate risk in terms of how the infrastructure access is provided. And this is developed based on publicly available open access data. So these are the 4 tools that we have developed. Along with those tools, we have conducted several researches as well, and published them, which is basically trying to focus on strengthening knowledge on CWIS. These are some of the snapshots of few research publications that we have come up with, which talks about citywide inclusive sanitation, different components of CWIS, be it subsidy for fecal sludge emptying, or be it looking at what kind of data we need to collect at the city level, or looking at how to strengthen utility accounting and cost management systems, or looking at how gender can be, how services can be more gender inclusive. And all of these materials are available on the learning modules present on. So all of these websites and tools, they have a learning page, and and you can access the resources on these learning pages as well. Now coming down to the measurement framework. So the measurement framework that I'll be talking about in today's discussion was implemented in 8 cities globally. 5 cities in South Asia, 4 from India, and 1 in Bangladesh. And then again, 3 cities in Sub-Saharan Africa. So that's Dakar, Kampala, and Lusaka. So the learnings that we will present today over here are based on the implementation and implementation exercise that was conducted in these few cities. So the measurement framework is globally applicable, but then as we saw in the last session as well, a lot of the indicators that come up with, they need to be contextualized. They need to be, they need to relate to the utilities or the city governments needs, and they need to, the data systems and the data architecture. And what I mean by data architecture is basically the systems that are currently established on places, or the mechanisms that are currently existing at a city level or at a state level, which can help to generate those data and look at the reliability of those data and utilize those data for decision making. So that depends on the lot of consultations with the local stakeholders as well. We want to thank, and I would like to take this opportunity to also thank our partners, local partners, who have provided us with continuous support and feedback on the measurement framework to make it more robust and to speak to the local needs as well. Very much great thanks to Professor Chari and his team, who has supported us with implementing this measurement framework in the cities of Warangal and Narsapur in the Indian context as well. Now, I'll not spend much time on this framework, but then just to relate it back to the service outcomes and the service functions. And we will talk more about the indicators with respect to how the indicators can help you measure or quantify what an equitable service delivery looks like, or what a safe service delivery looks like. So not now coming down to the indicator framework. Now, if you look at this framework, so though I have mentioned over indicator, I have also written in the brackets that it is components. So these are essentially, the indicators are transformed into the components of it. Components of each, I mean, what do we mean by equity? And we look at the different indicators that are currently over there existing under equity. And that basically is the essence of what equity stands for. Similarly, for responsibility, what are the components of it? So that is why I'm also calling the indicators as components of these particular 6 thematic areas. Now look, I have mentioned the numbers over here, given that most of the times when we have encountered data collection from the cities, the first question is what we get is, how many data points are we talking about, or how many indicators are we talking about, given the effort estimate that is required to collect those data. So that is why I have mentioned the indicator, the number of indicators, but then I want to specify one point over here. So the outcomes, if you look at it, these are very much quantitative in nature. So there are primary indicators, and then there are sub indicators linked to it. And these indicators basically help you understand the outcomes that is currently being achieved at the city level. And they are very much quantitative in nature. Now, coming to the system functions, I think in the previous session, there were a lot of discussions about looking at the enabling environment, looking at policy, looking at regulations. And the functions are nothing but they are reform-oriented qualitative indicators. They basically help us understand how the reforms are structured at the state level, as well as at the city level or at the regional level. And these are not, I mean, yes, we can term it as indicators, but then they are eventually questions and they are interview guides. And with yes or no answers and accompanying qualitative narrative, which basically helps you understand at what are the functional attributes of a particular region or a particular city, and what kind of enabling environment is supporting the delivery of services. So I wanted to highlight that particular thing with respect to the system functions. What I will do in today's session is we will quickly go over some of the indicators, but then I'll not get into detail of the indicator definitions and the calculations. It can be accessed from there, all on the website www.cwiscities.com. If you go over there, you can download the indicator calculation, the formulae, what kind of data sources are required. So a detailed checklist is provided on the website, and I'll show you where on the website you can download these from. Coming down to the indicators on the quantitative outcomes, looking at equity. So the first indicator that we look at is the subsidy amount that is being paid for non-seaward sanitation as compared to the seaward sanitation. We looked at, I think there was one recommendation with respect to this indicator, looking at how much money the government is spending on seaward sanitation, or how the government is supporting the delivery of services in terms of fund support, financial support. And we want to particularly look at it from the non-seaward sanitation, which is very much focused towards the lower income communities, towards the hard to reach areas, and seaward sanitation, which is basically whenever we look at a city, is primarily concentrated towards the center of the city, which again brings in the economic disparity and the other related aspects of equity linked to this. So the first indicator is focused on that. Then we have a set of indicators which are focused on gender. Now, I'll briefly walk you through those as well. So we are looking at the number of women that is present in gender, like decision-making bodies. When we talk about decision-making bodies, either it can be the local water utility, or it can be the local city or city corporation, or a city municipality. So trying to understand what percentage of women share the decision-making space, and also looking at not only there is no, so we want to look at the entire organogram. So basically also trying to look at how many women are there in the leadership positions as well, who has the authority to make a decision. So that, and then we also look at the gender pay gap in terms of, is there any kind of disparity between the pay ranges for men and women. These are few aspects that we look at from a gender lens. Then coming down to the sanitation workers equity. And we have two parts to it. So we are also looking at sanitation workers safety, which falls under the safety bucket. But then under equity, we are looking at whether in terms of the dignity and equity aspects of sanitation workers well-being, particularly trying to understand whether there are training or certifications required to be a sanitation workers, and at whether the training covers different aspects of sanitation workers, their dignified livelihoods. So looking at whether it covers labor rights, whether it covers occupational safety or health risks, or whether the sanitation workers, regardless of their employment formality. So we have seen that a lot of times cities employ sanitation workers either through permanent, being a permanent employee of the municipality, or it can be outsourced to a private operator who then goes out to provides sanitation workers support to the municipality on a contractual basis. So irrespective of their employment nature, so we want to understand whether they have any kind of channel for legal recourse or not, their voices are being heard or not, in terms of being able to set up a union, or workers are covered by social security, their health insurance are provided. So all of these aspects are looked after under sanitation workers equity. So these are the few 8 indicators under equity that we look at. Now coming down to safety. Now what we have done with safety is we have split it up into few parts. The first part is looking at IHHL, so looking at individual household level toilets at the citywide level. We also look at individual household level toilets at the lower, specifically for the lower income communities as well. And they can be, like, we can define lower income communities with respect to particular region or a country. It can be slums, it can be notified slums, it can be unnotified slums. So that depends. So that is the context specific modification that I was talking about towards the beginning of my presentation. So we have broken it down across the value chain. So we look at percentage population that has access to safe individual toilets. And what we mean by safe is, when we started looking at these indicators, one of the key things that we found out was that there is a lot of discrepancy with respect to the definition that is being used. And I mean, like, we were coming in from at a global level. We were looking at cities in Africa, we were looking at cities in Asia. So when we looked at the so much discrepancy with respect to defining the term safe, we then adhere to the definition of safe toilets as that is defined in the shit flow diagrams, which looks at the contained definition is as per the shit flow diagram. In terms of emptying and conveyance across the value chain, we looked at the percentage of on-site sanitation systems that have been desludged, mechanically or semi-mechanically. and number of desludging vehicles which comply with maintenance standards. Maintenance standards, or in case there are licensing norms or operators engaged by the municipality with respect to via licensing agreement, trying to understand the percentage of operators that adheres to the licensing norms, which also looks at the maintenance standards as one of the components of the licensing regulation. We also look at different aspects of treatment infrastructure, looking at whether the collected fecal sludge is disposed at the treatment plant or not, in order to ensure that we have a close track on illegal dumping of fecal sludge into the open environment. Then we also look at whether the treatment capacity at the be it at the fecal sludge treatment capacity or be it at the wastewater treatment plant, whether it is sufficient to cater to the entire city's generation or the demand or not. And then also look at the utilization capacity of the treatment plant. So those are few aspects that we look into the treatment related indicators. Under disposal and reuse, we also look at the effectiveness of the treatment plant in meeting the prescribed standards. I think there was also one indicator suggestion with respect to having standards and whether the samples are adhered to those standards or not. And we look at it. So I'm mentioning only about the primary indicators. So these are again broken down into looking at the effluent standards, looking at the biosolid standards. So different components that goes into each indicator. So those are the indicators with respect to disposal and reuse. Now coming down to the community and community toilets and public toilets. So particularly we look at how much of your toilet facilities, be it community or be it public toilets, they have they are meeting the safely managed norm or not. With respect to community toilets, we also look at whether in terms of the adequacy and whether there is enough, whatever the percentage dependent population which needs to access or which do not have access to individual toilets, whether they have access to safe shared facilities or not. We have mentioned whether how many of those toilets adhere to the universal design. Here we are referring to every country would have their own norms, their own standards with respect to, like we in India, we have a norm set of standards from the public health, the CPHEO department in India, which adheres a particular toilet to maintain certain standards, design standards. So whether the toilet facilities are adhering to those standards or not. We are also looking at whether in terms of the adequacy, we are also looking at the waiting time of at a shared facility and the distance from the household to the shared facility. So those are few aspects we look at a community toilet. Some of the similar aspects also are also looked at the public toilet spaces. Coming down to as I was mentioning, with respect to the sanitation workers' safety, we are looking at the use of having SOPs in place with respect to health and safety standards, whether they exist or not, whether they are being complied and sanitation workers are following those norms or not, in terms of compliance, and it is being monitored and enforced or not. Looking at desludging operators are registered and licensed. And again, licensing includes the compliance with practices all the licensed desludging operators should adhere to the usage of PPE or safety and protect the health and safety of workers. Or regular health checkups are conducted and not for the sanitation workers. So these are few aspects at the safety of sanitation workers level. As I mentioned, with respect to the individual household toilets, we also have a dedicated set of indicators which looks at the lower income communities population. And similar to whatever we saw in the safety at the citywide level. In terms of safety related indicators at the beyond IHHLs and beyond community and public toilets are also looking at educational institutes and healthcare facilities. With respect to educational institutes and healthcare facilities, so right now we have not disaggregated these indicators further as we have disaggregated for the citywide individual or the community or public toilets, primarily because this is somewhere what we have seen is the level of data that the city has or the city has access to is quite is very much less matured as compared to the individual toilets. And we plan to expand it further over the coming years as and when the data ecosystem matures as well. Couple of other indicators that we are also looking at is with respect to water contamination compliance and also with respect to incidence of fecal oral pathway diseases. So these are few additional indicators which we're looking at under the safety component. On sustainability, again, like one aspect that we are looking at is with respect to the reuse of how much of your treated fecal sludge or the treated water effluent that is coming out of the treatment plant is being reused. And in addition to that aspect, we are also looking at the cost financial aspect of sustainability, trying to understand the operational cost that is being recovered for the sanitation infrastructure. And when I talk about the sanitation infrastructure, it's again across the value chain. We are looking at public toilets. We break down this indicator into looking at public toilets, community toilets, and also the treatment infrastructure. And then also looking at the capital investment. So basically trying to also understand how much of the capital investment is coming from government transfers. So that gives us an understanding on the dependency of the city government or the local water authority on other lines of financial sources, be it depending on a donor agency, being dependent on international or development financial institutes, or dependent on private sector as well. So these are few elements that we are looking at sustainability, and I would encourage all of you to please go to the website on this. I'll share the link on the chat box as well. And you can go to the website to download the indicators and in details and go through them. And also, please feel free to also so these are just these we have implemented it in the 8 cities as I mentioned, but then there might be indicators which you think that are much more relevant, or you want to implement the indicators on an incremental stage as well, that okay, let's focus on certain certain aspects of these indicators at the current moment, depending on the kind of ecosystem that you have to support those data generation, and then go on to, after one round of data collection, maybe increase a few more indicators as well. So looking at it from an incremental approach point of view also helps. I'll briefly, very quickly walk you through the indicators under responsibility, under the functional attributes as well, or the kind of areas or the kind of interview guide areas that we have, or we look at under each of these under each of the 3 functional attributes are looking at legal mandate for service delivery is inclusive or clear and inclusive or not. And then, so that is something that we look at the state level or at the regional level. And then a mirror indicator, which also looks at whether the local authorities are delivering those inclusive services or not. Looking at the organogram, looking at whether the service authority staffing norms are adequate to meet the service delivery goals, as mentioned in the legal mandate documents. Or looking at whether the staff positions are filled or not, and are capable, and this local service authority is capable to execute that mandate. Again, like these all suggestions also came in the last session, whether there is a separate line item for sanitation or not. Independent of solid waste management, very much focused on sanitation, looking at the liquid waste component of it. Oftentimes we see that they are being clubbed together. So that is the reason why we have also stressed on that, having a separate line item. And then again, looking at whether whatever the local authority is generating in terms of sanitation revenue, whether it is being ring-fenced and utilized again for the sanitation interventions or not. In terms of accountability, again, we have 7 indicators. So primarily looking at whether there are performance indicators set and monitored at the regional level or the state level. And then again, the local authorities are actively reporting on those performance indicators. Be it in the case of India, like we have at the national level, we have the CWIS Survekshan, we have the service level benchmarks. So it's like those are just examples from the Indian context. But then I'm pretty sure there would be every country would have their own set of indicators that the country as a or any particular ministry within the country is implementing with respect to understanding how the cities are performing on delivering services and whether the cities are reporting on it or not. We have also mentioned that there should be clear and progressive performance targets. And what we mean by progressive targets is like, it should be again incremental, like it should not be like 100%. That's an ideal case scenario, but then it should be realistic to the baseline and corresponding to the baseline that is there. And every year after every annual data update, the city and all the relevant stakeholders should come to one place and have a conversation with respect to understanding what the next year's target should be for their particular city or particular region. Performance data from service authorities are transparent or not. Not only we looked at, and then again, there are incentives or penalties tied to performance of the city in terms of delivering services. In terms of resource planning and management, trying to look at whether there are clear financing frameworks which are developed at the national level or at the regional level to guide allocation of financial resources to the city or the devolution of funds. Again, bringing in an example from India, we have the 15th Finance Commission, and there is a clear framework which defines how the funds will be devolved to the states and then to the city governments. Or in the case of Bangladesh, where there are annual program evaluations. So based on that, the local government's division, they devolve the funds to the Purashabhas. So there should be a clear financing framework, and also at the city level for them to understand what is the requirement of the budget and how do they prioritize on that. So whether the city has a service area strategy or not, whether the city has a service level plan or a financial investment plan or the investment decision making, what is the kind of quality of that particular investment decision making, I have seen cities just using a 10% thumb rule as a benchmark to develop their budget. But then cities should be, so it's also about all these functional attributes are closely linked to each other. Like, for example, the capacity of a city becomes very much important with respect to understanding whether the city will be able to plan for itself or not. So it's idea. So, and going back to the point which I made earlier as well. So these functional attributes basically help one to understand, looking at it as question and interview guides to understand where their own city is standing, and then having a discussion with the relevant stakeholders in order to understand and assess how the city can progress from their baseline scenario. Now, coming to just to show you the extent of CWIS indicators in inclusion in the government of India intervention, and I'm pretty sure if you do that kind of an assessment for the other countries, you would also be able to understand where your country stands in terms of the CWIS indicators and whether you are measuring inclusive sanitation service delivery or not. This is just an assessment that we did for the government of India. Different mechanisms that is there currently with respect to data collecting and decision making, and we saw that though there is, and as I have mentioned, traditionally governments have focused on infrastructure, so, and which is also very much clearly visible in the high number of indicators being overlapped with safety at 70%. But then if you look at the equity, you see that there is a very steep drop, and we are only tracking close to around 30% of the indicators that we just looked into, be it on gender, be it on subsidy, be it on sanitation workers equity, so that there needs to be a progress, and we need to have conversations around that. So, and this is with respect to the outcomes. Now, the scenario with respect to functions is even more weaker, and we need to work very much effectively towards that. If you look at the, and this is again for just an example from the Indian context, but then we can also do that assessment for the other countries to basically understand how the enabling environment in order to strengthen service delivery is standing, and very like the functional ecosystem is quite it needs to be strengthened a lot as compared to the outcomes. And I think the focus of CWIS is also with respect to having a dedicated focus and conversation around the functional attributes or strengthening functions at the state level, at the regional level. And which is a very clearly signified from this particular assessment. I want to share now that is for the with respect to the different indicators and how the indicators are being integrated into different government initiatives. Some of the challenges that we have seen from the field, from collecting data from the field, and we have done this data collection across 8 cities over a period of 3 years. So we have looked into data for over a period of 3 years. And we found out that there are 4 different broader buckets in which we can look at challenges for data systems. One is data availability, one is data sharing, data usage, and then sustainability. And I'll give you brief examples of what we mean by each of them. Let's look at data availability and across the value chain. So if we look at across these 8 cities, what we have seen is there is a very strong government-related drive to collect data, but then which is very much focused on the containment and the user interface component only, be it through the sensors, be it through different schemes. Like in India, we have the Clean India Mission. In Bangladesh, we have the Urban Governance Improvement Infrastructure Project program. Elsewhere, we have like for example, in Lusaka, we have Lusaka Water Service Planning Plan Development Program. So there are program-linked MISs which collects data, but then that is very much focused on user interface and containment systems. Beyond that, if you look at the conveyance, desludging, treatment, what we have seen is there is donor-funded interventions. Now, donor-funded interventions are also there in the user interfaces or the containment systems, which is usually done during preparation of a city sanitation plan or deployment of community toilet surveys or public toilet surveys. But then if you look at the entire value chain, which is in blue is the donor-funded interventions. That is very much done through donor-funded interventions. And it is, we have hardly seen a case example where it is done by a government initiative that data is being collected beyond user interface and looking at, or beyond containment systems and looking at the remaining part of the value chain. Similarly, again, with respect to the treatment plans, there are logbooks and data collected as a part of logbooks. Again, that is again donor funded and through donor funded interventions. So one of the critical feedback that we got was, or observation that we had was, data sets for emptying and conveyance are limited. And it also brings us a question to the sustainability. How sustainable are these interventions if the data is being collected, or how sustainable is the data collection interventions if the data is purely being collected through donor-funded interventions? One thing that we have also seen is that very limited focus on pro-poor and gender intentional indicators in terms of data availability. Talking about data sharing, what we have seen that is there is very limited data sharing among different departments. Let's take one example with respect to the schools and healthcare facilities. We have seen that most of the schools and healthcare facilities data is being collected by regional authorities and not shared with the local government, the local city authority. And the local city authority is the one which is planning at the city level, which is the planning authority lies with them, with the municipality to plan for, and which includes also planning for the schools and hospitals within their administrative boundary. And there is very limited data that is being shared among different departments. Data use is something, again, that we have seen. Most of the times that the data is collected is through compliance. Like there is compliance from the national government, there is compliance from the regional government, which leads the cities to collect data and report it upwards. But then there is very limited support that is provided to develop city capacity to utilize that data for their own planning needs. And that is something that we have seen that is missing from the value chain of data, or from that consuming data and then utilizing data point of view. So these are few challenges that we have seen. This is the website that I was talking about. And I'll not spend much time on the website given the time constraints. but just to give you a sense of where the materials can be downloaded from. So if you just scroll down and if you click on the CWIS learning here, you will be taken to the page where you have all of these resources and materials, including the data on, including all the indicators as well, and read more about the CWIS initiative, and you have all the details about a particular city or a particular how that particular or who the different partners are. So please do visit this website, and you can click around and play around with this website to look at the different resources available. Just also wanted to highlight how the website is currently placed. So the website allows us to compare data across cities, and these are the yes or no qualitative functional attributes, as well as it also allows us to select one city and look at that particular city's performance over years. So it also allows you to compare trends, or how the city is performing or how the city has progressed from the last year, and help the decision makers to make a decision with respect to that. So the tool is readily available. Please write to us if you want to explore how we can add your city to the dashboard and help you into using that particular data for decision making, better decision making. So that is on the global.
Mr. Ram, can we just give a bit of breathing time for some questions, and then we'll move to the next section?
Or either works. The next session is only, like, the CWIS app is only about a couple of slides. Either we can do that or come back to the questions, or we can take up questions.
We can link it to CWIS app as we a bit of a discussion on the indicators. So, just concerned about, people have commitments for some of them. So it's important to have a bit of conversation. So thank you very much for outlining a very comprehensive presentation on indicators. So friends, you have seen, can we just, Ram, can we pull it down and then bring it back so that we can see some faces? Yeah.
Sure.
So are there any questions, immediate questions? If you don't have questions, I have questions for you.
Yes, sir, I have a question.
Yeah. Mr. Gupta, over to you.
Yeah, thank you very much for the presentation, Mr. Ram. It's very, it's impressive. And I have two questions, actually. The first one is on the indicators, if I remember it correctly, on equity, percentage of women in leadership positions. I'm just wondering if there is really an association or correlation between female leadership to a greater attention to sanitation in your experience. We're talking a city governance system with mostly focus on socioeconomic development. I think it doesn't matter whether we have female or male leaderships. The main drive would be to improve the socioeconomic development of the city. Perhaps an idea to have a certain number of women peer pressure groups from outside the governance, which can also, serving the purpose of raising awareness on sanitation development. On the my second question would be, at least 3 stakeholders are accountable for CIWS indicators, namely the government side, users or household, and service providers. I think from the service provider's point of view, in my opinion, licensing is the key or the top of the pyramid to indicators for other indicators as well. So licensing on the top of the pyramid of indicators. Now, if you build a pyramid of indicators, considering the various stakeholders involved, what would you put on the very top, which also drives other CWIS indicators? My concern is if I see a lot of indicators, then I have problems in, linking or relating in between those indicators. So if I build sort of indicators pyramid and I can see what's on the top, then I think it would help me a lot to link that up. Thank you.
No, thanks, Sandra, for those couple of questions. I think I'm like, the short answer to the first question is I have seen on the ground that having female leadership does impact how the services are being delivered on the ground. It can be as simple as, like, let me give you an example. In the case of one of the cities where there was scheduled desludging being practiced, and at the household level, when the desludging services were being sent to the particular household, it was the female household, the female of that particular household who was there to cater to all the forms and all the, because the male used to go out to their daily jobs. And I think and that particular city's mayor, the chief administrative officer was also a female lady. So coming back to the challenge that we saw on the field was that households did not, so they have a form with respect to understanding whether the operators are complying to the PPE gears or not, or whether addressing any kind of questions with respect to the septic tank, or when was the septic tank built, or when was the septic, and these are male private operators who are asking these questions to female household ladies. And which also, which in our experience and in our conversation with that particular city operator or that particular city partner, we also found out that like a lot of the services were only after reaching the service point, the private desludging operator came to know that they have to do the services twice, and that impacted their or they need to make 2 trips in order to empty that septic tank, because they were not able to collect that information from the household member who was there to provide, or the female member who was there. Or oftentimes the female members are also very shy to have a conversation with a desludging operator who is a male person, asking them questions about septic tanks, which we brought it back to the administrative table, and we had discussions with the city government. And given that it's a very small example, but then given that the municipal mayor was a lady, was female, she understood that. She could relate to it, and she was very much proactive into providing a solution that, and from the next service onwards, there were one female operator or the female representative from the municipality accompanying the male desludging operators as well. So these are smaller examples, which helps you understand the kind of impact having female members at the decision-making table would also help you deliver more inclusive services and more efficient services. So I have seen that personally, so that I am of that opinion. Secondly, with respect to if I have to prioritize on the indicators, for me, it's not about one indicator. For me, I would prioritize on the functions, because if you have the functions embedded in a city, in a particular government enabling environment, if you have strong accountability mechanisms, if you have strong acts and municipal bylaws created, and which can help you deliver the responsibilities better, I think the outcomes fall into place. And if you have strong regulations to enforce those, the outcomes will eventually fall into place. So for me, if I had to create that pyramid, it would be the functions on top, and I would prioritize the functions. Obviously, I'm not telling that the outcomes are of less importance. Yes, the outcomes help me understand the city's health. But then in order to scale it up, in order to understand, in order to also sustain it for a longer duration, I think functions would be a priority set of indicators for me. And also based on the conversation that we have had with a lot of different stakeholders, I think we strongly feel about that. I don't know, Professor Chari, yes, I see your hand up if you want to share your thoughts.
Yeah, so just a quick response to Mr. Gupta's point. And this conversation happens in many forums. Is there any correlation between service delivery improvement and women's participation or gender participation? I think the issue is not about direct correlation, but it's about democratizing the process. The idea is not just about drawing a one-on-one correlation, but everybody should have an opportunity to participate, and certain actions have to be affirmative. Some actions have to be because of the social norms, certain participation doesn't happen, democratic decentralization doesn't happen. So what we are doing is we are encouraging equity and rights-based approach from participation point of view, one need not really expect overnight improvement in service delivery. So I think that's pretty much unfair to think on those lines that, okay, I've created a gender committee. Will it result in improvement in service quality or improve in financial sustainability? May or may not, but it's a right. Everybody has equal opportunity, has equal right to participate. So I think that's my quick reaction to it. So any other questions? So let me just throw open some questions to all of you and in relation to Mr. Ram's point. Now, all of us as cities, we have a fairly decent system to monitor the progress with regard to municipal solid waste management. Would you agree or not? In terms of broad collection efficiency, how much waste is generated, how much is collected, how much is segregated to some extent off late, how much is processed. So I would like to know from you, do you have a better understanding of better indicators, better monitoring system with regard to municipal solid waste management, wherever you're coming from? Yes or no? How many of you think we have a decent system? Please raise your hands. I know it's pretty late in the day, but I'm just asking you, do you have systems? At least your city governments have some mechanism in place for municipal solid waste management. Okay, anyone else from Bangladesh? Yeah. Pankaj Saab, how come you're so silent today? Shravani Garu, if you are there, in Andhra, what's happening? Do you have a better control on municipal solid waste? We have better indicators, better tracking systems. It's a question that we are asking to you, for you to look at, and what Mr. Ram is trying to drive home. Do you have a similar system in place? There's a point which Mr. Dongo mentioned. We don't have data, we don't have indicators, so you need to invest. The way municipal solid waste management has evolved, invested time, resources, GPS systems, surveys, we don't have similar thing happening for human waste management. So this exercise, what Mr. Ram has presented, I mean, it appears to be a lot of indicators, but I think these indicators are important. Like the way we have invested for water, we have invested for solid waste management. It's time we start collecting, investing in basic sanitation services. Of course, some governments like Bangladesh, Nepal, India, they are making attempts, but there's a lot to do, especially on the equity point of view. He said about 23% of indicators are only tracked through the national surveys. So the floor is open for another couple of rounds of discussion on what shall we do to strengthen the monitoring system for sanitation. When I use the word sanitation, we are not speaking about municipal solid waste management, but I'm speaking about human waste, from starting from containment all the way to safe disposal. Be it black water, be it gray water, fecal sludge. Any thoughts, any quick ideas? I know nobody wants to respond. Yeah, go ahead.
Yes, actually, I was just trying to reflect my interaction with the municipal corporation in Lucknow. And all this solid liquid, I'm just giving the example from the solid liquid waste management, from where you can understand what are the situation from for other services. And when I was discussing with the higher level official, they said, yes, everything we have, the data and everything, but slowly and slowly we went down, down and down. The actual person who was responsible for all repository data, and we came to know that, yes, there is a system, but who is the service provider? Here is one private vendor, and they are feeding the data without any system of verification. So when you go to the data of the municipal corporation, yes, solid waste is segregated, managed, done everywhere as per the norms. But when the community, and we take their feedback, it's a complete contrast. So what I'm saying that when we are having a monitoring system, there should be always a system of community feedback, and that should be verified from that, because that are the person, the service that we are providing. So if the community, if you are not taking any feedback, the system that you are developing for monitoring and evaluation, if you are not taking into account the feedback of the community, I think it's very difficult to really rely on data and really ensure that services are made.
So what you're saying is a bit of community monitoring mechanisms, social audit mechanism should also be integral
Yes.
to this whole process.
Yes,
Okay, great point.
yes.
So Vivek, would you like to comment on this? You know, why there is such weak data come in this sanitation space, knowing fully well that it is one of the core public health issue, whereas municipal solid waste has a better monitoring system. What are your thoughts? Vivek, if you're there.
If it's me, Vivek Pandey, so I wish I could answer it, but I'm in a traffic. I'm driving right now. So
no, I can hear you very well. Please speak up.
So see, what basically I think is that one area where this sector lacks is that we have the policy comes first, and then there is done data validation is done after that. So, and the other reason we have lots of data gaps, which I think is that because the person who collects the data in ground is least aware of the policy which this data is going to complement. So that person comes very down the ladder and he's least aware about the policy interventions. So I think we need to strengthen the person who is going to collect the data in the field. Until unless he is not made aware of, we will not have a very authentic data in this sector.
Okay, let me ask you, Vivek, and also Mr. Singh and others, do you think the commissioners, the city managers, are they asking for data at all with regard to sanitation? They ask for data with regard to solid waste management, but do they ask for data with regard to sanitation? Are they questioning the ground personnel in the first place?
Not at all.
No, sir, I would like to comment on to this. So into the government sector, we have almost every commissioner or every PDDRD or every mission directors. There's a weekly meeting, there's a review meeting to track the progress of sanitation and related aspects of it. So all that progress which is tracked is based on the data only, and which comes from the field, districts and the rural or the urban areas. And believe me, I'm sorry.
Toilet construction, you mean to say for the toilet construction?
Even for the waste collection, waste segregation. So there is lack of authenticity to that data.
So your point is that reliability of data is a big question mark, and
this will remain the data. The reliability will always be in question until unless the person who is collecting data is well capacitated with his abilities to collect data. He should be first aware that why is he collecting data and what's the reason of that collection.
Okay, so Ms. Chandu, would you like to comment before I pass on to Mr. Ram again? Would you like to comment?
I was just posting posted it in a chat. Exactly to your question, sir. I was just thinking if that is the fecal sludge management is even the priority of the city managers or not. That's the main questions. When we talk about the city managers, specifically in Kathmandu or in Nepal, like when we talk about fecal sludge, when we start to talk about fecal sludge, then they are not willing, or they are not, they are a bit skeptic, compared to when we talk about solid waste management. So when we talk about sanitation, it's about solid waste management for them. The priority is solid waste management to FSM. They have very least knowledge on fecal sludge management. That's my understanding, sir.
Okay, thank you. So I'm conscious of the time. Ram, just to bring point this conversation, and probably you could also reflect on these 2 points. One, there's still lack of interest or lack of attention from the leadership on this whole subject of citywide inclusive sanitation and FSM. at the leadership level, so nobody monitors. This is one. And the second point which Mr. Vivek mentioned is that the reliability of data is a big issue. These are the 2 points that are emerging. Would you like to reflect on these 2 points and also continue with your presentation? Sorry for interrupting, just to keep the conversation. Over to you.
No, I think those are very valid concerns. And data quality, I think one of the things that I did not mention in the challenges that we looked upon was data quality. And as Mr. Vivek already pointed it out, data quality, there are a lot of different aspects to it. It is a much more bigger basket in itself, and different issue and different challenges. Capacity is one aspect to it, but then also we strongly believe that if the data is not being used by the city for their own planning interventions, the quality is always going to be a challenge. The moment we shift that conversation from reporting data to higher up authorities to utilizing the data for planning or for decision making at their own city level, that quality, it will affect the quality, and then we will see. So there are a lot of different factors associated to it. I think that's one very important thing which Mr. Vivek pointed out too. And I think definitely very important with respect to data quality. Thank you, Professor Chari, for those. I think that was a very interesting conversation with respect to how we can also learn from other sectors, and how we can also link it or have learnings from solid waste management, have learnings from water sector. So I think that's very important. And coming back to the presentation, I think there is one.
Sorry, Ram, before you
Yes.
start, Vivek has another point. I think his
Sure.
hand is raised.
So one major thing which I realize that is still the progress of any any interventions or any scheme is still compared or still measures on the basis of data, but not on the behavior aspects, because we don't have data to measure the behavior aspects of behavior change. So that is also where we need to improve. Because there could not be data which can show the behavior improve. So if there could be something on the aspects of behavioral change through which we can measure, that would also add to this, because we have nothing to measure on behavioral aspects. That was it.
Yeah, so there's a question in the chat box whether solid waste management efforts are made to improve the data quality and reliability of municipal solid waste management. So Dr. Malini asked. So I think it's a valid question, but I think solid waste management has matured quite a bit over time for a couple of reasons. One, there is a very strong citizen feedback mechanism that has been built as part of CWIS Survection and as part of various surveys that have been conducted. There's a very strong weightage given from the citizens' feedback point of view. That's, I think, is strengthening the reliability of information. Second is also that there's a greater technology infusion with regard to solid waste management. Again, because of the mature private sector startups and others, a lot of companies have come, which is tracking the quality. The third, of course, is there's a bit of automation, as I said, both at the treatment plant level, at the intermediate points, and also at the generation point. There's ICT tools are deployed as part of Smart City mission and a number of other missions. Third important thing is many of the solid waste management is going through a lot of PPP projects, both bundled and unbundled. When you have PPP projects, payments are linked to the quantity of information that flows, be it in the form of quantity of waste flowing in, or extended producer responsibility initiatives where the dry waste is going and then monetization is happening, where self-help groups are actually getting paid for delivering dry waste, like in Pune and other places. So the data maturity is happening because of the external factors, because of the PPP, because of the technology, because of the citizen exposure to solid waste management. I think, but with regard to sanitation, these are not happening to the extent that solid waste is happening. So I think that's the difference. It will take some more time, but I think there is a great scope for technology infusion also in this space. And I think that may improve the data reliability as well as data ownership. So, for example, STPs are in place. STPs are never monitored. So that's because nobody is asking anybody. Whereas solid waste management, at least there is a visibility from the citizens' point of view. There's NIMBY, there is a leachate problem, and then the communities make a lot of noise. So STP dysfunctionality is not questioned, whereas solid waste dysfunctionality nowadays is questioned by NGT and many other players. So I think it's a question of transition. So Ram, over to you. Any last points, any last slides before we close?
Sorry, can I come in for a short comment? Yes,
Yeah.
actually, I'm also thinking that ultimately, when we're talking about the sanitation services, it is related to our public health, but somehow it is also dealing with the disease surveillance. So we should be also thinking of, if really services is happening, everything is tick mark, then how the disease surveillance is really giving a secondary sort of information. So if everything, and that data should be, as Ram mentioned, that we are very weak in using the data for the improving our own planning process, because whatever data that we have planned, maybe some of the thing is left out, but that experience that we gain during the execution and service, that experience, that data somehow we are missing, and we are not linking with the disease surveillance system. And when you see the sanitary department and the health department who is monitoring those things, they are completely disconnected. So there is a link how we can connect, and that will give you another indicator that even if all indicators are put tick, 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 but ultimately if disease like waterborne diseases are happening, there is something missing link that we need to add, close it.
Yeah. So you are looking at impact indicators in terms of public health outcomes. I think it will take some more years before we establish a strong correlation. So Mr. Ram, before we wrap up the session, would you like to share some of your slides or any comments?
Yeah, I think, and going back to the point which Mr. Nagendra just mentioned with respect to, and also going back to the discussion we had on digitization, and I think there is still a lot of road to be covered on planning, on collecting data, on monitoring, on measurement interventions. But I think digitization is definitely a key process or a key factor which can help us address some of these concerns that we were talking about. Another tool on that digitization bucket is the service assessment and planning. And I think the entire conversation, I know that Professor, you mentioned about how the CWIS as a concept and CWIS as an approach is still being discussed and debated and discoursed upon with a lot of different stakeholders. But I think we all acknowledge that even after so many years of delivering services, delivering sanitation services, delivering solid waste services as well, we have still way behind on the liquid waste management monitoring and decision making on that perspective. So I think service assessment and planning will, like this particular tool is our one foot into the roadway to address the or to understand how we can deliver more inclusive services. So this is just a platform which can help us make decisions with respect to inclusive service delivery. And what we mean by inclusive service delivery is to address these few questions, like understand who does and who does not have access to services, or what types of services they can access, or what the households can pay. So we always ask about questions related to infrastructure. What is the capacity of that infrastructure, or what is the model in which the infrastructure is being delivered? But then these questions are often neglected with respect to inclusive service delivery. This particular tool, the services assessment and planning tool, explores different business models, looks at different tariffs and different regulatory levers alongside infrastructure. So yes, infrastructure is at the crux of it, but then it also looks at the other aspects of the enabling environment to understand and optimize how we can reach better levels of equity, safety, and sustainability. So just to give you a very visual graphic of how the tool operates, and this is the second last slide. I'll take another couple of minutes to wrap it up. So looking at sustainability and equity and safety. So these are three scenarios. So the first scenario is the baseline scenario where there is 55% safe coverage. The second scenario is by scaling container-based systems or other interventions similar to container-based systems, the access coverage or the safety coverage can be increased to 71%, and the equity is also increasing. So this is just an example scenario from Lusaka, where this tool was implemented. Currently, the implementation is going on in 10 different cities across the globe. Sorry, it has been already been completed in 10 different cities. Right now, implementation is going on in a few cities, and conversations are happening in Uttarakhand and in Kenya, some of the cities. But then this example is from Lusaka, where by having an intervention, we looked at how the safety percentage can be improved, as well as looking at how the equity could be improved and the sustainability can be improved as well. So for the utility, they were looking at only 6 KPIs to understand which intervention is the most beneficial for them, or which meets their vision and their targets. So the 6 KPIs that they were looked upon was cost to serve the household. What was the cost that the government had to bear? What was the cost that the households had to pay? Both the lower income households as well as the non-lower income households. Obviously looking at how much of by whichever scenario, looking at how much of the waste is being safely managed. And then the role of formal sector and the private sector. So these were the KPIs through which based on these 3 scenarios, or the 3 intervention scenarios, it allows the municipality, or it allows the local authority to take a decision that which is the most suitable scenario, or which is the most suitable intervention, or the most efficient intervention for my city. And what it does is it allows you to play around with those inputs to understand how you are going to, maybe there are 8 options given in your DPR, or given in your CWIS plan, or your FSM plan, or your city sanitation plan, and you look at choosing one of those solutions, how you can achieve more coverage, or how you can achieve more equitable service delivery. Some of the iterative inputs, these are just illustrative inputs, looking at how you can play around with the public finance, or how the public finance would affect your service delivery outcomes in terms of safety, in terms of equity, and in terms of sustainability. All looking at how a particular hardware choice would help you achieve from 71% to 81% in terms of safely managed. Or obviously in terms of market structure as well, and the regulations in place, how that would also help you achieve from 55% coverage to maybe 81% coverage, or increase that. So it helps you understand which is the most important, best decision for that particular city. This is how the dashboard visualization looks. So if you see that this is the baseline scenario, this is by intervention A, this is by intervention B, and similarly it can go on. And based on that, across the different infrastructural intervention options, how the service coverage is expanding. And the tool also helps you understand how much of your service is being delivered to lower income households or to non-lower income households, and allows you to understand which is the best appropriate solution for my context for that particular city. Similarly, it looks at the market structure, looks at U stands for unregulated, R stands for regulated. And if you see that in the 55% scenario, most of them are unregulated, but then in the scenario where there is a 81% safe coverage achieved, a combination of both unregulated plus regulated. So there are certain private operators who are regulated, there is the authority. So there is a combination of regulatory structures and the market structure. And it also helps you understand how the equity, public expenditure, and the life cycle costs are being impacted. And also looks at which particular intervention option allows you, and how much would it mean in terms of expenditure on the household's costs, or in terms of the government cost as well, how much the government is going to bear, or how much the cost recovery can be done from that particular household, from that particular intervention scenario. Again, water requirement is another aspect of it, which allows you to make better informed decisions. So yeah, I would like to close with this. So there are a lot of tools available on the public domain. I'll share this presentation. Few of the links have already been shared, but please feel free to reach out to us in case you would like to have a conversation, in case you would like to understand how that particular tool could be helped or could be deployed in your particular city to help you address some of the challenges and issues that we talked about today. Yes, I would like to close here. And thank you, Professor Chari and Jyotsna, for giving me this opportunity to talk about these platforms, and hope it was helpful to the participants.